Hello, this is Kuldeep Chaudhary from Healthinindia. I'm in the chamber of renowned arthroscopic and knee replacement surgeon, Dr. IPS Oberoi. One of our patients, Mr. Mark Wismans from Sacramento, California, got admitted to Artemis for getting the arthroscopic repair of the meniscal tear that he had in his knee. Dr. Oberoi operated on him this morning, and it's 5 o'clock, just 8 hours after the surgery, and Mark is ready to go home. Let's now ask Dr. Oberoi and Mr. Mark how the experience was, what the surgery was, and how did it go. So, Mark, how are you feeling now?
Well, I'm feeling a little bit tired, but there's absolutely no pain. It's unbelievable, without any pain medication.
Do you feel any pain in your knee right now?
Nothing. Yeah,
Okay.
I couldn't believe it. I stood up and walked without any pain. He's very good.
So, Dr. Oberoi, kindly tell us what the procedure was and how long did it take, and what would be the benefits to Mark?
Mark is a heavy worker kind of thing. I mean, he's a guy who has been working hard on his knee, and he has been putting a lot of weight on his knee. He had an injury previously, and this injury actually broke his meniscus. So meniscus is a tissue which was inside the knee. This got broken. Now this knee starts to degenerate as this meniscus tear warms out over a period of time. What was beneficial for him is to undergo an arthroscopy. So what we did is we made 2 small punctures in his knee. So he was under general anesthesia, he was sleeping through the surgery. From one side we put in a small telescope. It's around 4 millimeter diameter telescope, so something like a tip of a pencil. And from other side we make a small portal. And then we look into the knee and examine all the parts of his knee. Wherever there was tears and degeneration, we have a special probe which is called as coblation. So it's a probe which doesn't heaten up the tissue inside, but would vaporize the tissue which is torn and hanging. So Mark had different areas of the knee which were inflamed, different areas of the knee where there was degeneration. The cartilage was torn, and in all those areas we cleaned the joint nicely. We fixed that meniscus back, and with help of a coblation we made the cartilage smooth.
Okay.
So we were able to protect his joint from degenerating further and reversed quite a lot of degeneration by doing this simple arthroscopy procedure. Now, it was a daycare procedure where he walked in the morning today, and in the afternoon now he's walking back home.
So, Dr. Oberoi, Mark came to India on crutches. What's the prognosis like? How strong his knees will be to bear? He's got a huge body definitely. So, how strong would the knees be to? Will he be able to do all kinds of work like jogging and all?
Understand very well. I mean, these things should have been operated quite a couple of years back. I mean, somehow due to so many reasons, Mark could delay all of his pain, and he was bearing this pain and trying to keep on continuing, which caused a lot of degeneration into the cartilage, a lot of damage already happening. Now this regeneration would take its own time. I mean, anybody who is as young as 20 would regenerate quite fast. Anybody who is close to 50 or 60 would take its own time for regeneration to happen. So we have to protect his knees by weight unloading, by putting on crutches for maybe week 10 days or so. He has to be on good exercise program so as to strengthen the muscles of his thigh. And we have to give an injection into the knee which lubricates his joint nicely. With this all, I think he should be comfortable in coming months. Yeah.
Okay, so Mark, that's good news probably. I know you've been working on your muscles very, very religiously. You've been doing all sorts of exercises.
Not only that, I did some pre-rehabilitation too back home.
Okay.
So I did as much as about 2 months of that. So I think that helped in my progress.
You feel stronger in your thigh muscles now?
Oh yeah. No, I built them up somewhat. I've got a ways to go, but I have the motivation to do it. So, and I don't have any pain to speak of too. So it's I'm excited to be able to walk normal again.
Dr. Oberoi, I would like to ask you one question. Most of the people who have knee pain, and they keep on going to various doctors. You are an authority on arthroscopy. Lots of doctors advise them knee replacement. I've always failed to understand where does arthroscopy stop and where does knee replacement is the only option.
That's a valid point. You see, whenever we find that there is a mechanical damage, there is a very typical history of an injury to the knee, which is very clear something is broken inside the knee. Now this is not degeneration, but if you don't get this treated right in time, subsequently over a couple of years it will become a degenerative. So I think it is important for us to recognize how fast we can diagnose an injury to the knee and treat it by minimally invasive thing like arthroscopy, rather than waiting for a couple of years when it becomes degenerate to an extent where probably arthroscopy has got a limited role and knee replacements is the solution. So that's the time of injury which should be recognized by the clinician and also seriously thought by the patients, because patient think, oh, it was an injury, I put some ice packs, now a couple of days down the line I'm better, I'm not able to run but I think I'm better, and that's the wrong thing, because if you were running before and if you're not running now, something serious has happened to your knee which needs to be investigated, and arthroscopy can fix most of the tears inside the knee, and it protects your knee from becoming a damaged knee 4 years, 5 years, 6 years down the line, when inevitably you will require knee replacement, and arthroscopy can't help you.
So you mean to say all sports injuries, they should not be ignored at all?
Absolutely.
An orthopedician needs to be consulted and some basic investigations to find out the cause and the
Good
extent of...
clinical examination, good MRI facility if it's available, will diagnose most of the tears which happen in the knee. And you see, knee is such a mobile joint. It has got so much work to do. You squat, you run, you jump, you do all the things with your knee. And if you don't take care of it, it is going to become degenerate sooner or later. So recognize sporting injuries, because that's the number one cause of knee problems all across the globe.
Mark, you've been to multiple hospitals, all over the world, in Mexico, Costa Rica, even in India, a couple of hospitals. How do you find Artemis?
Well, I think the healthcare here is absolutely wonderful. I mean, the doctor sure is wonderful, and he's got an easy name to pronounce, IPS. But this is one of the nicest hospitals I've ever been at, and the care is just as good as the other ones here that are here in India. And I mean, the staff and everybody is really good, so I'm very satisfied.
Do you find
I'm just a little tired right now.
Yeah, that
anesthesia.
appears from your face,
Yeah.
because
Yeah.
you're normally otherwise very cheerful.
Yeah, I'm just tired.
Do you find the doctors here more accessible, less of those administrative blocks? You can walk into a doctor's
Oh,
room
absolutely. In the United States, you gotta wait. Yeah, and you gotta pay too. So it's a wonderful thing. It's a little bit far to come, but it's well worth it.
In any case, Dr. Oberoi has always been known to be a very easygoing, very easily
Absolutely. He's
accessible.
very outgoing, yeah. I like him very much.
And he's already hinted to you that you can't have your wine alone.
Yeah,
So that's
right.
a doctor's prescription. So
Yeah, well,
probably,
that's it.
you'll have to invite
That's the
Dr.
deal, huh?
Oberoi and treat him with wine, because he's done such a wonderful job on you.
Absolutely. I got plenty of wine in the refrigerator back there in the guest house. So.
Thank you, Dr. Oberoi.
Thank you.
It was a pleasure talking to you, and you've done a nice job. We are very